sleep deprivation is not a tool that promotes learning or good patient care. So I'm hopeful that we as a society will start to recognize that, and we as an evidence-based field will start to recognize that sleep depriving our doctors in training and practice is really not the solution, and to come up with creative solutions to really protect the sleep of doctors as much as possible. I think that for most doctors, that would be huge because many, many doctors are sleep deprived.
You are listening to the Pinnacle Podcast, where we empower women in medicine through education, community, and actionable strategies for both the practice and the business of medicine.
Medicine is a lifelong career, and continuing education is crucial for professional development. Pinnacle is the first and only multi-specialty organization dedicated to addressing the challenges that all women in healthcare face.
Welcome to Pinnacle, the elite professional community providing education for women in medicine. At Pinnacle, we challenge you to pave your own path by helping you develop the skills needed to not only stay in medicine, but to excel. Hello, everyone. Welcome to the Pinnacle Prescription Podcast. I'm your host, Dr. Rupa Wong, and today I'm joined by Dr. Laura Vater. Dr. Vater is an oncologist at the Indiana University Simon Comprehensive Cancer Center. She's a writer and an advocate for clinician health and well-being, as well as a TEDx speaker. In 2022, her writing was featured in Pulitzer Prize-winning author Anna Quindlen's book, Write for Your Life. She's developed a tool to help patients and clinicians prioritize their health, the SMILE scale, which we will be discussing later. And she's been awarded the American Medical Women's Association Charlotte Edward McGuire, MD, Outstanding Resident Mentor Award in 2022. Thank you so much, Laura, for being here today.
Hi, Rupa. Thank you so much for having me. I'm thrilled to be here.
So much that we are going to dive into. But first, I wanted to start with just discussing what about your personal experiences or your challenges led you to advocate for humanism in medicine and clinician well-being.
Really two reasons. So my personal experiences and also my experience being the daughter of a female doctor. So my mom went to medical school when she was 37 and I was 9 years old. She had 3 kids. And so I actually watched her go through, she got a graduate degree, then she got a medical degree, then she went into internal medicine residency before the work hour restrictions. And now she's in her 20th year of practice in primary care in a rural area. And I'm so proud of her. And I just love the work that she does. She works so hard. But she works so hard. And I think so much of me as a young girl growing up, seeing a strong, really stubborn, really successful woman, it really gave me a lot of great skills as a doctor, as a woman, gave me a lot of ideas of what I could do. It opened doors to things I didn't know existed before. But at the same time, I had this inside look into what medicine was really like from a very young age. My mom studying while we were watching a family movie, or she was catching up on notes when we were watching SNL when I was in college. I just saw her work a lot and I saw how that stress affected her. And I think that's one of the main reasons that I think about and write a lot about clinician well-being and continue to advocate for it. And then personally, when I was a resident, I was in my second year of residency, and at this point in time, I had worked about 5 months back to back to back, 28-hour shifts, and just lots of fractured sleep. Lots of long hours, lots of fractured sleep, lots of really critically ill patients. So a lot of patients experiencing a lot of illness and witnessing death, but also not sleeping very well. And I noticed that my mental health started declining. And it really caught me off guard. It was really surprising to me because I had not experienced that before in that way. I remember being in the parking lot after a really long 28-hour shift. I'd probably been awake for 30 or more hours at that time. Mm-hmm. And I remember sitting in the parking lot of the hospital thinking, I don't really care if I make it home alive. And in that moment, it was just like I'd lost my vitality, and it was really devastating to me. And it was really I had a daughter when I was pregnant in medical school. I had my daughter when I was a 4th year. So she was 1 when I started intern year. So at this point in my life, she was 2, about to be 3. And it was really her face that kept me on the road that morning and kept me going. That devastating thought of her growing up without a mother. But I noticed that I kept having these thoughts of suicide in these really stressful moments, especially when I was sleep deprived. And so I am a writer. I journal a lot. So I journal when I was rested. I journal when I was really tired and stressed and sleep deprived. And I could see these patterns. I could see that these patterns were very clearly connected to my sleep and my stress. And so that's another reason that I have started to really dig into this personally and also trying to advocate for others.
Laura, that is a really powerful story, both your mom's and then yours, because I don't think people recognize how deep it can go, right? They just think, oh, it might affect your mood or your irritability, or maybe they might even understand your clinical judgment and your decision making. But when it gets to that point, which it really can, that's eye-opening. And I think also what you do and what, the different fields that many of us are in, but especially you, oncology is such a emotionally draining experience that if you're not well rested, can be super challenging, I would imagine.
Yeah, and this was even before oncology, this was in my internal medicine training.
Right.
But now as an oncologist, I'm a GI oncologist. So I take care of patients with primarily aggressive and metastatic cancers. So primarily pancreatic cancer, liver cancers, and colorectal cancer. And so my mentor told me when I was starting this field that 80% of my patients will not survive long term. And so most of the work that I'm going to do is helping them navigate hard decisions, supporting them through that, helping them to feel well, and also kind of ushering them through the end of life. And I've really had to think deeply about how do I process and cope to continue to protect my longevity, to be able to do this work, and also my health and well-being in the process.
That's amazing because you have a lot of insight and self-reflection probably from the journaling. But how did you feel then powerful enough to begin to advocate for change in a system that seems that it's just done, right? That this is the way that it is. You have to accept it. We were told, I still remember on my first year of ophthalmology residency back when it was separated, this is like a military. You respect the chain of command. You never go outside of the chain of command. That was our orientation the very first day. You never badmouth the program. You don't tell outside people how many hours you're working. I mean, this is what we were told. That was the kind of environment that many of us were facing 20, 25 years ago. So how did you feel powerful enough to start to try to change that?
It really started with whispers of just, does anyone else feel like sleep deprivation is not necessarily a rite of passage, but possibly a violation of human rights? And it just started through whispers, through communities on social media. It started with whispers among our residency program. But what really allowed me to become an advocate that became more vocal, because I think a lot of people feel this way and they think I just need to get through this and then I'm going to move on with my life. And I think I was in a very lucky and privileged position that I had an incredibly supportive residency program, first of all, where we had town halls where people were honest, where we said, you know what, this is not working, or this person is a bully, or we are working way too many hours on this rotation. And we actually had a program director that listened, and we had people that actually cared about our well-being. And we were part of the solution. I think when we're talking about these things, it's really easy to label what's wrong, but it can be really hard to actually figure out what are workable solutions within the limitations that we may have, whether that's staffing or budgeting or whatnot. But if you can work really to develop relationships with your co-residents, your chiefs, your program, and then once you develop those relationships, you figure out what's not working, and then you're part of the solution, where you have those relationships, and those solutions often take years. Often those solutions do not apply to you. A lot of the solutions that now my internal medicine program and now my fellowship have, those solutions did not apply to me, but now they exist for people coming after me. And I think that's really where it comes down to, is that it's so hard to find the energy in your day-to-day practice of medicine to try to think, even reflect. Oftentimes we just repress. Okay, that was a hard time in my life. Mm-hmm. It's in the past.
Yes.
Right? But if we can find ways to try to make positive change, whether it's at the program level, the local level, or even the national level, I think all those changes add up.
Oh, it's truly inspiring what you do and how you look at it just holistically and creating actionable solutions as opposed to just, all right, here's the issues. Because I do think many of us are conditioned to, the whole path in the medical journey is head down, pre-med, get it done, then get through the next step, and then get through the next step, and just like, don't complain and just get it done. And on the other end of that rainbow, life will be wonderful. And I think that's just not the right way to look at it, as you've been saying, which is really amazing. Now, tell me a little bit about the SMILE scale, because I think that now plays into this, that you've developed to assess life enjoyment among clinicians. Can you explain how the tool works and how are you seeing it impact the well-being of healthcare providers?
When I was an intern and I had a 1-year-old daughter, I was learning, and I was also studying for my board exams, right? Because we still take board exams in residency.
Mm-hmm.
I was learning all of these mnemonics for things like randomly encapsulated bacteria. Remember all those things we used to learn, all these memory tricks for like these random things. And I was thinking to myself, okay, I'm a mom, I'm a doctor in training. I just need a simple tool for me. How can I just have a way that I can come back to every single day when I'm exhausted? Just a quick check-in tool, something that takes less than 30 seconds that I can just realign. If I'm getting off track with my health, how can I realign? So that's what I created. So the SMILE scale is a really simple self-check-in tool. And for those who are listening, I invite you to do this with me. It's just a check-in. So each letter of the word SMILE stands for one healthy behavior that's really important for our health. And it's really 5 questions. If the answer to every single question is yes, it's 5 points. So your score can go anywhere from a 0 to a 5. So the first letter, S, am I sleeping enough? Am I getting at least 7 to 9 hours of sleep? For most of us in training, that answer is no, but hopefully that answer for you is yes, and you get 1 point, and we can talk more about sleep later if we have time. The second question is about movement. Am I exercising? Have I been physically active for at least 30 minutes or more? If that answer is yes, give yourself 1 point. The next one's about stress reduction. Inhale and exhale. Am I finding ways every day for ideally at least 10 minutes to reduce my stress in a healthy way? There's all sorts of unhealthy ways to reduce our stress. But if maybe it's deep breathing, maybe it's meditation, maybe it's prayer, maybe it's going for a walk in nature or listening to music or even reading a book. If you have a healthy habit that helps you unwind and de-stress, give yourself 1 point. The fourth one is love and connect. Have I meaningfully connected with my closest 1 to 3 people today? If I meaningfully connected with them? If that answer is yes, give yourself 1 point. We know that our relationships, especially those closest people in our lives, are very protective for our health. There was a study called the Harvard Study of Adult Development that actually found that loneliness, or that subjective feeling of being alone, is a predictor for not living as long, and it can shorten your mortality for up to 8 years. So those close relationships are really protective for our health. And then the last question for the SMILE scale is E, eat to nourish. Am I eating at least 5 servings of fruits and vegetables a day? We know that most organizations are saying 10 or more, ideally 13 or more if you can. So, but if you're getting at least 5, give yourself 1 point. So sleep, movement, inhale and exhale with stress reduction, love and connect, and eat to nourish. So that's somewhere from 0 to 5 today. And that tool is being used. We just did a pilot study here at our cancer center looking at this tool among patients. There have been a lot of other clinician groups who are starting to publish with this tool in the literature as well. So it's exciting. I know that anecdotally people have reached out to me and say they like that it's just a simple check-in tool that they can just check in every day, and kind of very gently, is there an area that they might need to just nudge back towards health?
And that's wonderful. So it's not even just for physicians, healthcare workers, but also patients. But are you able to now just even, it's so simple and it's so easy, but it seems, obviously you created it, it hits all the high points. So it can vary throughout the week, the month. That'd be a great tool in the residency programs. Is that something that you're now working on?
Yeah, some residency programs have adopted this, and I give a lot of talks to grand rounds and residency groups across the nation, and I introduce it as a simple tool. We talk about first institutional or system level changes, right? And then we talk about personal health as just one small component of the overall picture of clinician well-being. But we do talk about that, and then we kind of talk about really specific tips about, caffeine management, and we talk about how to consume more fruits and vegetables when you're on the wards, and all of these things. So it has been a tool that I'm hopeful that it's been helpful for some.
That's amazing. And I am going to start using that tool today and actually share it with my husband as well, because I think it hits everything, which is amazing, especially this very specific, you said, meaningful relationships and meaningful connections, right? And not just many times in our day-to-day, we just go through, the checklist of things. So I think the meaningfulness of it is important.
Mm-hmm.
Now, when we talked about support systems and these relationships, are there specific systems that you believe institutions, going to the system change, or hospitals or even private practices can implement to start to promote the well-being of their clinicians, especially the women?
Absolutely. There's a couple things here. I think when people ask me, how do you improve clinician well-being? I think it really comes down to a few simple things. Reasonable workloads. And that can be defined in different ways, but I think it's what is a reasonable workload that you can get the work done in a day, in a reasonable day, and not have tons of work that just bleeds into the margins and into your weekends and nights. So reasonable workloads, adequate support. For me, that I have an RN that works directly beside me that helps me with orders, inbox management, peer-to-peers for insurance companies, all of these things that just help me to focus on being present with a human being in front of me. So reasonable support, whether that's pharmacy support, depends on your field, right? But having that support is really, really huge. And a lot of doctors just do not have that. And that's a huge reason that they're experiencing burnout. Third component is accessible and ideally free mental health support before you think you need it. So having a structure in place of that mental health support before crisis strikes, I think that's really important. And then, a few other things is just getting rid of low value work. So no more extra modules, excessive training, documentation demands that may be redundant, extra notifications, pages, calls. If we can get rid of that those things are helpful. And then in the last thing I'm thinking of when you're mentioning this, some people have what's called a code lavender, which is like a patient dies or something really terrible happens. It's this team that kind of descends to support the clinician. And that can look like different things, but that can be one tool, or even just the general recognition that we work in a field that's not normal. It's not normal to experience, I'm sure in your field, people that have had vision loss or trauma that has just changed their life, people that have a diagnosis of cancer, someone who's experienced something else traumatic or an illness and the loss that comes with it. Just knowing that the work we do is not normal. Maybe that means debriefing, maybe that means therapy, maybe that's journaling, maybe it's different for each person, but recognizing that the work we do is not normal and that we need extra ways to cope and process.
That's a lot that also, though, doesn't seem as if it would be that challenging to institute, right? There's very small steps that can be taken to address each of those points and create just a better work environment. Because you and I both know, especially since we're mid-career at this point, there are a lot of women burning out of medicine, and it always seems to be the workload, the lack of support, emotionally and physically, right?
And I think other things that we kind of touched on, I'm sure you have before, are just how can you have support outside of work, but at home? Can you have someone come clean your house? Can you help someone with errands? Can you help someone, whatever that? My husband's a stay-at-home dad, which helps me immensely because that means that he takes on almost all the responsibilities of caring for my daughter and the home stuff and home projects and management. But if you can hire that out, if your partner is working or working long hours, whatever you can do to have that support, not just clinically, but personally as well.
I love that. I'm a big fan of outsourcing and delegating everything that does not bring me joy, because ultimately, though it's expensive, and this was hard from the daughter of immigrants to do this, because they felt like, well, I can do my laundry, and I can mow the lawn, and I can do this, and I can, right. I'm not going to pay the $9.95 to get my groceries delivered because that seems excessive. I can just, but once you do, you make that transition, that mindset shift. It's really so helpful at just enjoying all of the parts of your life a lot more.
So true. So true.
All right. Now, talking about that, we talked about the personal support and just being able to delegate and get extra help. What do you think are the biggest obstacles then for achieving a healthy work-life balance for women in medicine? And do you have any other strategies in addition to getting support and getting help when needed to overcome those?
Yeah, I have lots of people that reach out to me from all over the world, really. And of course, my personal experience as a clinician, as my mom is a clinician as well. And I think that so much of why women in medicine burn out or why they leave the field of medicine altogether is just a level of overwhelm that surpasses their ability to cope. It's just that oftentimes women take on most of the responsibilities for personal things at home and for childcare. So is the homework done? Okay, tomorrow is ABC countdown for school being over. And okay, I've got to remember that it's beach day. And all these things in their personal lives. And often if they're a dual physician household, it's often the woman that takes on those things, right?
Yep.
And then this other component is that just medicine is just a really overwhelming field to be in, not just because the hours can be long and patient demands, they're sick and patients have a lot of needs, but it's also that there's not, like we mentioned before, there's often not that component of support. So there's a lot of inbox management that happens. My mom's sometimes doing inbox management till midnight, or charting until midnight, or falling asleep on the couch, or it becomes things that you have to catch up on the weekend, or taking on more hours clinically. And then of course those hours kind of bleed into everything else. And so you reach a level where you don't have time for your personal health. That's the last thing on your radar. You're just trying to survive, and you feel like your personal relationships may suffer, your health may suffer, your mental health may suffer. And it becomes this place, at least those that I know that have left the field of medicine altogether, it was not because they didn't love medicine. They loved those moments with patients. And that is what gave their careers meaning and value. But it was just that they were simply asked to do so in a way that was not sustainable for them to live with vitality.
So well said. And I think that encapsulates just the heart of the matter for many of us in healthcare, especially women, especially mothers that are trying to juggle all of these different spheres. What do you do personally to maintain that?
So I have been very, 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 very clear, even when I was jumping into my career out of fellowship, what this was going to look like. And just a single thought on what we were just talking about. If any listener is finding themselves in that position, just remember that you have value and you have negotiating power and you have options, even when it feels like you don't, because a lot of people feel like they're trapped. And that's not the case, that you do have value and negotiating power. So for me, coming right out of fellowship, I chose oncology for a very clear reason. I loved the field, but I also knew that I could be well compensated and work a little less. I chose academics because I wanted to write, and I had an academic place that supported narrative writing and novel writing. It's kind of my academic goal, which is incredible because I get to work on my hobby while being in academics. So I have 3 full days of clinic per week. I have 3 tumor boards. But I have 2 days during the week, Tuesdays and Fridays, where I work from home. I do academic stuff. I do meetings. I do advocacy. I give a lot of grand round talks, and I write. And then I am in a big practice group. So there are a lot of doctors. I only work 2 or 3 weekends a year. I'm only on call 2 or 3 times a year, 2 or 3 weeks a year. And I have a fellow who takes first call. And we have a nocturnist now, a hospitalist who takes those inpatient calls. So that's been huge for us, is that we've been working on advocating for a long time for that. And so I know that I could be an oncologist in a different setting and work a lot more, probably make a lot more money. But I have personally made a choice. And I live in the Midwest where we have a low cost of living. And so I can be the single income earner for my family. I can work 3 full clinic days a week. I can still, with my inpatient responsibilities, I'm still full time. But I've been able to set up, at least so far, right? I'm waiting, hope the other shoe doesn't drop. But so far, I've been able to set up carving out time for my hobbies and passions, continuing to care for patients. And those clinic days are busy. They are busy. When they happen, they're busy, but still being pretty clear about having enough follow-up time and enough new time for new patients to really be able to provide the care to my patients that feels thorough and feels compassionate. And then, of course, I'm lucky to have my husband, who's a stay-at-home dad, who does drops off my daughter at the bus and picks her up and takes her. He took her to, piano today. And he does those things, goes grocery shopping and cleans the house. And we have a house cleaner. We have tried. It's not that it's easy. I'm on a lot of committees. There's a lot of asks. I always have to try to figure out whether to say yes or no. And that's something I'm still working on. But I feel like it's a journey. It's a journey that I am working on continually, trying to, as much as possible, prioritize my health and my relationships. And I feel like I'm starting to kind of slant towards thriving.
I love that you detailed the specifics of your schedule because, to be honest, up until this point, I thought to have the kind of schedule that you had to be in private practice, like myself, where you're creating it, or self-employed private practice. I have to be specific. But you created this at an academic center. How difficult was that?
I am employed where I trained. And so I had a lot of really good mentors. I actually work clinically more than most of my colleagues. There's 5 of us that do just GI oncology. 2 of them have 1 day a week of clinic. 1 of them has 2 days, and then 2 of us have 3 days. And so I'm actually among the busier, more productive of my team, which is kind of nice because I do need to be able to provide for my family and I get paid through my clinical work. But then it also allows me to, so I'm contributing to the team. I'm seeing plenty of patients, but then I also have this other time that's carved out. And those days off aren't perfect. I have tumor boards those days. I'm calling patients. I'm finishing up on notes. I'm, doing committee meetings. It's not as if it's this blank slate of a day, but then it really does allow me to have time in the margins, and especially on the weekends with my family.
I love that. And that just speaks to the power of just viewing the possibilities and carving out what you need to be happy. So I think that that's amazing. All right. Changing directions a little bit, looking to the future. What do you think are key changes that you hope to see in how the medical community as a whole addresses the mental and emotional health of its members? I think what you're doing on social media is the amazing beginnings of it, but I want to hear what else you want to see.
I really hope that there's going to be a culture shift in how we as physicians and we as just nationally, how we view sleep and how we look at the data on sleep. Incredible data has come out in the last 30 years on sleep, and we truly know that without adequate sleep, our cognition declines, our memory, our ability to process complex information declines, our physical coordination declines. And we've actually recently found that our empathy declines, that physicians who have been awake and who work night shifts and who are exhausted are less likely to feel empathy for a patient's pain and are less likely to prescribe pain medicine. So we know that in all aspects of practicing medicine, sleep deprivation is not a tool that promotes learning or good patient care. So I'm hopeful that we as a society will start to recognize that, and we as an evidence-based field will start to recognize that sleep depriving our doctors in training and practice is really not the solution, and to come up with creative solutions to really protect the sleep of doctors as much as possible. I think that for most doctors, that would be huge because many, many doctors are sleep deprived. I think the next step is really how do we focus on that relationship with patients? That's the core of medicine. That's why we're in this, is that connection and caring for a human being in front of us. And how do we get back to that? And then get rid of all those other things that really are just low value, what we call misery reduction in all the wellness committees that I'm on. How do we really get to misery?
I love it. Misery reduction. I think I might use that phrase in my personal home life. I like that.
We're not talking about like enhancements. We're just talking about like misery reduction here.
Yes.
And for many doctors, that would go a long way. Getting rid of redundant trainings and getting rid of modules that are not needed and extra notifications and pages and, and just having someone help with inbox management if you've got a busy inbox, and someone to help refill prescriptions. Simple things so a doctor can really focus on what matters most, which is that connection with the other human being in front of them.
I love that. And I think that it's so important. I've seen my life changed once I hired a virtual assistant to do a lot of those things for me. And she's amazing. And now my kids depend on her because they say, oh, I need to order this. Can you send this to Claire? Here's all the links, because they know that's my virtual assistant. It's so good. Yes, it's been very helpful. But again, the pushback when I talk about that is usually, oh, my hospital won't allow it, or my, practice won't. And just creating that culture shift where people in healthcare are supported in whatever way to reduce misery would be the first start.
It's actually really interesting. My institution is now about to pilot an AI that will actually write notes for you. I have no idea how it's going to go. It's going to probably be really rocky at first, but it's supposed to understand the subjective, and then you'd have to kind of dictate the physical exam out. But there's a lot of creative solutions out there. I think the goal is to not make things more difficult for physicians, but if we can get rid of useless stuff or needless or low value work and just focus on the patient in front of us, then doctors are going to be happier.
I love that. I absolutely love that. All right. What is your pinnacle pearl? This is something we ask all of the guests to share with other women in medicine.
Our days are busy. They're full of interruptions. Sometimes it can feel for me that something can happen in one patient room and then I'm about to step into another patient room, and it can be hard to focus on the person in front of me. So something that's been really helpful for me is I actually use the door frame as a physical reminder. And I say to myself, I'm usually sanitizing my hands. I'm about to walk in the next room, but I take a breath and I say, there's a person behind this door that's a human being that is counting on me to pay attention. It's just a way to help restore my presence. And I do the same thing before I come home from work and I walk through the door from my garage into my house. Again, there are human beings behind this door that are counting on me to be present, counting on me to pay attention. And for me, it's just a really simple kind of physical reminder to kind of put aside, at least for that moment, what has just happened before that and to be present.
That's wonderful because, I love routines because I think it creates a lot of order in chaos. And in routines, they always talk about a threshold routine, right? To separate work from life or vice versa to get you ready. And with your mantra, you're creating a threshold routine for both entering the work sphere and also entering your home sphere, which I love. So I'm going to also institute that.
Yay! I love that. The threshold. I love that.
All right, Laura, where can people find you? Share all your links, please, because I know that so many want to.
I'm most active probably on social media through Instagram or Twitter, and that's just at Doc Laura Vater, all one word. You can find me on my website, lauravater.com. I also have created a new life support community that's on Patreon, so you can check that out too.
Thank you so much, Laura, for being here today. I learned a lot, and I am sure our listeners will too.
Thanks, Rupa, for having me. It's been great.
Thank you for listening to the Pinnacle Podcast, where we strive to elevate the voices of women in medicine and inspire excellence across the healthcare landscape. Until next time, keep reaching for your pinnacle.